Hello, everybody. I'm Alex, NHF video host and board member, and today is Friday, December 4th, and I am elated for our special guest, Charlie, who's our NHF lobbyist, and he has an update and report for us. How you doing, Charlie?
Excellent, Alex. How are you?
I'm doing pretty good, trying to stay enthusiastic and inspired and, grateful for to hear some updates. And I know all of our viewers and NHF members are as well, because of our great network we have here at the NHF and, all the hard work you're doing trying to, represent NHF at the Capitol and, work on some type of bipartisan legislation to prevent this mandatory vaccine.
Well, there is something that we'll be asking NHF supporters to do fairly soon, federally with Congress. But the other request will be for them to get active in their states, all 50 of them, and do what you can in your state legislatures for sure. There's no exception to that rule. It happens every winter in every state. Here in Virginia, for example, we just lost big last winter because the Democrats took control of our government and they removed the legislature from decisions on which vaccines our school kids have to get to attend school. And now the health commissioner can add any vaccine he wants. And there are 72 shots right now our kids have to suffer to get their civil right of education. And he has threatened to add the COVID vaccine as soon as it's ready, even though COVID doesn't really affect kids. Federally in DC, the opportunity that confronts us for NHF members is going to start very soon because DC's local government, the District of Columbia, has passed a bill not only allowing kids as young as 11 to vaccinate without getting consent first from their parents, but also the bill has language prohibiting your doctor from noting the vaccination in the medical record, prohibiting the insurance company from listing the vaccination in the explanation of benefits given to the member who uses the insurance company, but also prohibits the school personnel from making a note in the child's school records of the vaccination. So it's really a parental concealment act. Now, NHF members may wonder why we would have anything to do with yet another stupid law coming out of a DC government that's full of Democrats anyways. Well, it's because DC is special. It's overseen by your Congress from the Constitution because they didn't want your Congress to be under bad influence by the DC government. So whenever DC passes a law, Congress has a month, 30 days to overturn that law. And with a coalition of other groups, NHF has a couple members ready to introduce a resolution overturning the DC law, specifically Mike Lee, a Utah senator, and Congressman Cloud of Texas. He's, I think, a new congressman. So the mayor has 10 days starting anytime now to sign that bill into law or veto it, after which the DC Council has a chance to override the veto. At that point, and we'll let our members know when that point starts, we'll have a huge activist effort to get every NHF member to ask their congressman, the representative, and both other senators to support, co-sponsor a joint resolution soon to be introduced to overturn that DC law. Number one, overturning that law will, protect parents in DC in the short term, but for long-term purposes, going through this exercise to have NHF members contacting their members of Congress about this assault on parental consent for vaccines will help NHF in the long run identify friends in Congress for other issues. And there will be other issues around vaccines or COVID, especially since Biden and his task force have threatened vaccine mandates either directly or indirectly through the states or through corporations as they limit our access to travel, work, and or tracking, however that manifests. And we really are unclear how it's all going to manifest. We can't know everything in advance of what these international special interests and their politician puppets are going to do in the various countries, including ours. We have to be prepared. So we have a tangible short-term project about to start federally to overturn DC's attack on parental rights. We want all our members to get active in all 50 states to, number one, oppose the COVID mandate. Number two, help efforts to insert mostly Republican oversight of gubernatorial emergency order extensions. Right now, governors have no leash on their lockdowns and mask orders, and hiring people to snitch on businesses. In Virginia, we have a snitch Gestapo Governor Northam has created, and other states too. I'm pretty sure New York, Michigan, mostly Democrat governors. Those are things that we want the legislature to weigh in on, to act as a brake on these endless extensions of emergency orders. So that's number two, the one being stop the mandate. Number two, insert the legislature in the process of emergency designations and orders. Number three, Biden has threatened tracking with these vaccines. We want efforts to replace opt-out requirements for these vaccine registries with opt-ins. Through HIPAA, the privacy law, which isn't much of a privacy law, most states have registries about your kids' vaccinations, and that data is shared among different agencies. And that can be used to hurt you with the COVID vaccine if you want to fly, work, or bank. So we want to really put a limit on this data sharing for vaccinations. That's the third opportunity in the states. And the fourth opportunity is civil rights. Vaccine refusers have civil rights, and we need to enforce those civil rights in occupation laws for nurses and doctors who don't want to vaccinate where they work, or with other employees that may have to test or vaccinate to work, for transportation laws to fly or board a bus or subway, for medical licensing laws for doctors who want to issue medical exemptions or not administer vaccines in hospitals, or patients you may have to vaccinate to get treatment in a hospital. There are a host of these codes in the states that NHF has to really follow and encourage members to get active on in each state, because that's where a lot of the action is going to be. So that's just vaccines and COVID. And I'll stop there if you have any questions, but otherwise I'll continue on to a couple other issues.
Well, just to clarify, so you were saying for the DC, the mayor has not signed that yet.
Correct. There's been a delay in the council sending the bill over to the mayor for her signature. So it's been confusing for some of us activists on when this 10-day period starts. Apparently it hasn't started yet. So if we have 10 days before the mayor has to sign it, she can sign it at any time. If she doesn't sign it within 10 days, it becomes law. And that's when the 30-day period starts. So we'll only have a month to get Congress to overturn this law. It's going to be a great grassroots effort, because in part it's not just about vaccines, and also in part because unlike the other states that killed minor consent laws, this minor consent law in DC isn't just about allowing kids as young as 11 to vaccinate without their parental consent. It has that added concealment factor that none of the other states broached, which was doctors can't. I mean, this is fraud. You're a doctor, you vaccinate a kid, you can't note it in the record. You're an insurance company, you can't list the vaccination in the explanation of benefits, the EOB, that goes to the member. You're a school bureaucrat, you can't list the vaccination in the school record. That to me is like fraud. I mean, how is DC going to get its doctors, insurers, and school personnel to follow that?
I know it's almost like they're testing the waters. How much can they get away with, before we really push back? Because maybe without switching too many gears, how could this connect to repealing the 1986 Act, or this bigger picture of the vaccine manufacturers being shielded from liability?
And, repealing liability is going to be a later effort. It'll be mentioned in our campaign sheet that our members will get. We'll have a page explanation, and we'll have a page letter that folks can email to the representative and senators. Yeah. And both those documents will be pretty much the same thing. We want to keep things simple, direct, repetitive, because that's how you help folks communicate. Because, grassroots is intimidating for a lot of folks. They're not used to contacting their congressman. I've been around for a few decades around DC activism, and it's not easy for your layperson to join the effort. We want to make it as easy as possible. Luckily our members are motivated, because you don't become a health freedom activist unless you're motivated. This is the most tyrannical aspect of tyranny worldwide among all the issues. Medical tyranny is the tip of the spear. It gets to the Great Reset. All these politicians saying we want to build back better. Biden said that. What's his name? Trudeau from England said that. Boris Johnson said that. What does that mean? Build back better. It's just the latest New World Order, demagoguery from these international leaders. And that gets to what we have in store for us next year with Biden. It's a lot of unknowns, and it's scary. That's why folks are scared right now. We really want Trump to win. We hope his evidence of fraud finds an anchor in some court, maybe with the Supreme Court. But there is a lot of doubt that we'll be successful. And if we fail, we have Biden, and we have to adapt. And
at least it looks like we do have the Senate, that could somewhat make it difficult for him to
maybe
with his agenda.
Well, maybe, unless the special elections in Georgia go to the Democrats. There's going to be a special election, a runoff among the two senators in Georgia. And if the Democrats win those two seats, that ties the Senate, which means that Kamala Harris, the vice president, breaks the tie. And that means the Senate is Democrat as well. And then we have total Democrat control of our federal government, which means total pharma control. Total big tech control. Tech and pharma are interchangeable in my mind. They're controlled by the international oligarchs.
It's like Google. Some people don't realize Google is a pharma company, in essence.
Yeah.
That's right.
Well, the Centers for Disease Control is a pharma company. They have, dozens of patents. Mm-hmm. NIH researchers have what are called buy-dole rights to royalties from these patents. So they financially profit personally from the potions from pharma that they help create and farm out to pharma for marketing. So how can we trust the independence of our regulators if they have a financial interest in the outcome of these studies and approval processes? So that's the COVID lockdown and vaccine threats that we face. There's also the allopathic doctors are trying to legalize hydrochloroquine with zinc. I think we do need to help them. They lost their FDA emergency authorization this past October or September after having gotten it this past March. That's been just a horrific Orwellian dynamic to the COVID hysteria story. The fact that for the symptoms faced from COVID patients, which interestingly mimic some of the radiation poisoning that is complained about with the 5G activist, hydroxychloroquine with zinc and some other therapies do a pretty good job of calming your heart and other symptoms such that you can recover before you're hospitalized. And so many doctors are scared to prescribe hydroxychloroquine with zinc. And if doctors or patients don't know about these cheap malarial treatments and natural protocols, they may be more easily goaded into the vaccine if they really are scared. So let's not forget to help our frontline doctors trying to legalize and get out there in the market these cheap treatments. Because for those that are sick from COVID and there's some weird symptoms, regardless of the symptoms, if there's an effective cheap treatment, if you get it early, if you treat early, that really hurts the case for the vaccine. So I think that's part of the conversation too. We do need to help our frontline doctors. So many of them are with us on concerns about vaccines. So let's not forget about our natural coalition partners, and including conservatives. Greg Glazer from Physicians for Informed Consent has written that conservative activists are our natural ally for health freedom issues. And we do need allies to care about health freedom to have success. We can't do it alone.
Yeah. There's a whole saying, if we want to go fast, go alone. If we want to go far, together. And real quick, I'll just make a shout out to all of our viewers. I just want to thank you for the difference you're making. And for those of you new to the NHF, please consider joining. For an annual membership of $45, you get our quarterly health journal called Health Freedom News, which is the #1 health journal in the health freedom movement, I can say with confidence. And also make sure to subscribe. Feel free to comment down below, like this video, please help share it. And for those, new to platforms like Rally Congress, it's super easy. You just put your zip code in, and right there you can, reach out to your Congress critters, senators, and basically help, help us get this critical mass for what we're, doing here, and, be a part of something great. And it's just important to remember, Charlie, I mean, just like what you're doing, just the importance that one individual can make, but then kind of the bigger perspective of, why there are nonprofits and organizations, and then the bigger, picture of, coalitions and allies and all of that. So if we want to go fast, we go alone, but if we want to go far, we go together. So yeah, thank you.
No question. And we can't do it with just Scott Tips or Kat Carroll or Alex Landry or Charlie Froman. We do need our supporters to participate in the campaigns that you just mentioned. Once this override of DC's attack on parental consent is loaded at the website, which we'll do as soon as it passes in DC, we'll need our supporters in all 50 states to input their zip codes, have that automatic connection with their representative and both senators, and press send. Yeah. It's that easy. And you'll get the response. You can do more than that. Contact Alex or me if you want to generate a phone call to the member or their staff. I'll be glad to join that call because we want to befriend these politicians because we have other issues, including 5G. If you want me to go into that real quick.
Yeah.
We just had big news from New Hampshire, which finalized a law passed required report concluding that the Federal Communication Commission is not using the latest science. Surprise, surprise. Have any of the agencies been using the latest in science for the COVID orders? Not really.
Isn't it settled? Isn't the science settled? Or I'm sorry to interrupt.
No, anyone who says the science is settled immediately is suspect. So New Hampshire had a committee with a lot of stakeholders finalize a report saying we need the Congress to push FCC and other agencies. Let me list them: FDA, NASA, NOAA, FAA, EPA, to do a cross study among all these agencies to acknowledge the science. I mean, the science has been there with thousands of studies with the U.S. toxicology program. People especially become concerned when it hits home with vaccines, when their kid gets injured, especially with families when they hear with 5G that their local small cell tower has a right of way that allows Verizon or some other wireless company possibly irradiating tower near their house or near their kid's school. When it hits home, people start to care. But the important part is we have a legitimate committee that was brought into order by a passed state law, concluding that we need a legitimate study. And by the way, politicians in New Hampshire, will you please get this going? So that will present a future campaign once we get a coalition going to see what kind of bill we want politicians to introduce in Congress to force the FCC and these other agencies to legitimately acknowledge the studies that need to be done to protect safety from wireless EMF energy. So that'll be a future issue. But the big news is New Hampshire's study committee finalized its report. That gives us ammo to push Congress to do something. So
I'll make sure to put a link for that in the description here.
Exactly. And on finalizing of reports, we have climate change, which is going to raise its ugly head with Biden and the possibly Democrat Congress if we lose the special runoff elections in Georgia. And the Environmental Protection Agency released a jet pollution regulation that has some geoengineering activists pleased that it's going to push the airline industry to clean up the pollution emanating from the exhaust of jet planes, which may reduce some of the cloud cover that has so many health freedom activists concerned. We'll have to analyze that regulation to see how good it is or how bad it is, and to see what future action NHF will want to take on that. But I am connected with some geoengineering activists, and which is the more important part of climate change. So if the climate change special interests push one perspective on this issue, I think NHF, working with geoengineering activists, will have a more useful perspective to push on this from the legitimate concern of jet pollution. Which is, so that's an issue to be discussed in the future. It's sort of a preview. We have a final regulation from EPA on jet pollution that we can look at, which will allow us to brainstorm on this issue with our activist friends and what to do about it. So stay tuned on that issue.
Does that connect at all with heavy metals and soil and the air a little bit?
It does, because what these jets are using in their fuel to pollute the skies is dropping on the soil and is adversely affecting humans and animals. So we're going to look at that for a future potential issue.
It's almost like our backs are all against each other, Charlie, and we're just being attacked, from all sides. But all we can do is have each other's backs, like literally, like we're all, trying to defend and prevent all these attacks on all fronts. But we can never give up. So,
well, that's why the coalitions are important. And, in free markets, we specialize. And to NHF, nicely, our mandate is health, protection, and freedom from all of the assaults. And so as we learn from our friends who are more specialized in these single issues, we can figure what the NHF perspective and opportunity is. And that brings us to our final issue, which concerns a lot of NHF supporters, and that is fluoride in the water. Since 2010, over 200 local governments have kept fluoride out of the water. And the current front for that battle is in Eastern Washington, Spokane, whose council just approved a grant to fund a study to fluoridate the water, which the special interests want. But luckily for our side, the mayor doesn't like that past grant because she does not want the water to be fluoridated, and neither do health freedom activists. So we'll have a future report on how we can have NHF members cooperate with other fluoride activists to get other local governments like Portland and Wichita are two larger governments that don't have fluoride in the water. But that'll be another opportunity for NHF members to get active. So that completes the report, those 4 areas. the broad COVID area, with frontline treatment, emergency orders, and vaccine mandates. It's a lot of issues in one. And we'll have the campaign loaded at the site for Congress to override DC's attack on parental consent. And then we'll have future reports on the implications of New Hampshire's pause on 5G, millimeter wireless radiation threats, the implications for EPA's jet pollution rule, and then the fight in Spokane, Washington, on how that can teach us how to get active on fluoridated water elsewhere. So that's the report, Alex.
Excellent. Yeah, I'm just, I'm pulling up our latest magazine right now, Censorship in Our Cancel Culture, because I'm sure a lot of people are wondering, it's kind of like how we started this video. I'm doing my best to be elated, enthusiastic, but then also have to be concerned, about these very serious, threats, to our current quality of life, but then more importantly, children and posterity. So for those wondering, like what can they do? It's like, please, get involved, be a part of these campaigns, join the NHF, look into our history. We've been around since 1955. I mean, an organization that's been around, that long has literally stood the test of time. And, we're very grateful for you, Charlie, what you're doing. And, yeah, so, I mean, on one hand, we got to follow up. So how about in a couple of weeks, we do another report like this to follow up, and, definitely with the DC, what's happening, right there with that local government, and some of these campaigns that we're working on, like fine tuning before relaunching. And yeah, so thank you. Any closing thoughts? That sound good? In a couple of weeks, we'll do another.
Well, sure. If folks want to reach me, my email is charles.frohman, Frohman, at thenhf.com.
I'll put it down below in the description.
Yeah. Give Alex and me feedback on what you've seen and heard today. We want your feedback. This is a fight that involves all of us. And don't be afraid to work with other groups. They're more focused on single issues. The nice thing about NHF is it's broad. And like Alex said, it's old. I think I read that in the 60s, they were instrumental in legalizing chiropractors. And, Alex has side businesses. I have other ventures. I was featured in Forbes for creating cash patients, which is extremely important in health freedom. So, if folks want to talk to me offline about that separate fight, it also indirectly connects to NHF, because it is a scary time, as we started with. Trump lost, and well, he probably lost. And he was for health freedom. Not always, obviously, people say he plays 5G chess and works with the powers that be, with the militarization of vaccines. Some folks doubted how supportive of freedom he was. But it's a fact, I think, that his laws is going to make things a bit more challenging for us with Biden. So we do have to step up our game in these distinct issues and work together. So things are a little bit nerve-wracking right now, and we do have to prepare for the coming year. That's how I feel. Alex.
Yep, you're absolutely right. Well, I just started sharing the screen here just to give some people a little taste of our publication here, Health Freedom News, and the latest information in here, really getting into the censorship. And so, yeah, so this is included. There's digital copies of all the back issues of the magazine. And for our members, they, receive the actual paperback version of the magazine as well. So yeah, thanks everybody for tuning into this. And thank you so much, Charlie, for everything you're doing. And, may we continue to have each other's backs and, just stay focused on making a difference like we're doing each and every day.
Exactly. Thanks, Alex.
All right. Talk to you later.